Hello, my name is Dr. Diwan S. Raja. Today I will discuss about anatomy of the cubital fossa. So what is cubital fossa? The cubital fossa is a triangular fossa situated on the front of the elbow. We can call this is a triangular depression on the upper part of the forearm below the elbow band. Okay, so this is a triangular fossa situated on the front of the elbow. Okay, so it should be here on the front of the elbow. So you can also say it a triangular depression on the upper part of the forearm below the elbow band. Okay, we got that. The cubital fossa. Then we'll go to the boundaries of the cubital fossa. This is the fossa that is triangular. Okay, so we'll find out the boundaries. So we'll make the point of the fossa here, one, another one here, and this is one. Okay, so these 3 points will connect, then we'll get a cubital fossa. Okay, so boundaries laterally is bounded by the brachioradialis muscle. This is brachioradialis. Laterally, it is bounded by the medial border of the brachioradialis. Okay, medially bounded by the medial border of the, okay, so laterally bounded by the medial border of the brachioradialis, medially bounded by the lateral border of the pronator teres. So this is the pronator teres. So we got the lateral boundary by the medial border of the brachioradialis, medial boundary by the lateral border of the pronator teres. Okay, and base is formed by an imaginary line joining the lateral epicondyle to medial epicondyle. So this is lateral epicondyle of the humerus. This is the medial epicondyle of the humerus. Okay, so if this is the humerus, this is the medial epicondyle, this is the lateral epicondyle. So the brachioradialis comes out of the lateral epicondyle. The pronator teres is a flexor muscle. It should come out of the medial epicondyle. Okay. Brachioradialis is an extensor muscle coming out of the lateral epicondyle of the humerus. Okay. We have an imaginary line between the lateral epicondyle and medial epicondyle, and we got the boundary, that is brachioradialis. The medial border of the brachioradialis forms the lateral boundary. Medial boundary is formed by the lateral border of the pronator teres. Apex is the meeting point of the, this is the meeting point of the brachioradialis and pronator teres. This is the apex. This is the base. So we got a triangular fossa that is situated on the front of the elbow, bounded by the brachioradialis and pronator teres, and an imaginary line connecting the lateral epicondyle of the humerus to the medial epicondyle of the humerus. Okay, we got the boundary. Okay, now we'll go to find out the roof of the, what structure forms the roof of this triangle. Okay, this is the brachioradialis, this is the pronator teres. Okay, this is the connection between the lateral epicondyle and medial epicondyle. Okay, so this is lateral epicondyle, this is medial epicondyle, this is the apex. Ideally, this is the triangular space, so it should have a roof. Okay, how the roof of the cubital fossa is formed? Roof is formed by the skin, superficial fascia, okay, the deep fascia, and bicipital aponeurosis. So roof is formed by the skin, superficial fascia, okay, deep fascia, and bicipital aponeurosis. Okay, we got the roof. So we got the boundary, we got the roof. In the superficial fascia, we'll get some cutaneous structure. We'll get some cutaneous structure in the superficial fascia. That is the median cubital vein. Okay, that is present in the superficial fascia. And also you get in the superficial fascia the medial cutaneous nerve of 4R. Okay, we'll also get lateral cutaneous nerve of 4R. So these structures are present in the superficial fascia of the roof. So what is median cubital vein? The median cubital vein is a connection between the cephalic vein and the basilic vein. So if you go to here we'll get, this is the cephalic vein, this is the basilic vein. So the connection is the median cubital vein. This is the median cubital vein, this is the cephalic vein, this is the basilic vein. So connection between the cephalic vein and the basilic vein. So we have a connection that is called median cubital vein. This is the median cubital vein. Then this should be the cephalic vein, and this should be the basilic vein. Okay, we got the median cubital vein. Okay, then we got in the superficial fascia of the roof of the cubital fossa, medial cutaneous nerve of the forearm. Okay, the medial cutaneous nerve of the forearm, this nerve, the medial cutaneous nerve of the forearm, this is important. This nerve, this is a branch of the brachial plexus. This is a branch of brachial plexus. Okay, from medial cord, from the medial cord, and its root value is C8T1. Okay, we got medial cutaneous nerve of the forearm, that should be located here. Okay, then we have the lateral cutaneous nerve of the forearm. This is the continuation of the musculocutaneous nerve at the level of the elbow band. Okay, this is a continuation of the musculocutaneous nerve, Okay, we know that musculocutaneous nerve is coming from which cord? From the lateral cord, from which nerve root? It is coming out from C5, C6 and C7. Okay, we got the medial cutaneous nerve of the forearm, lateral cutaneous nerve of the forearm, median cubital vein. These are the content of the roof of the cubital fossa. They are located in the superficial fascia. Okay, then we'll go to the another content of the roof is the bicipital aponeurosis. Okay, bicipital aponeurosis, we get it, the bicipital aponeurosis. Okay, that is this structure. This is the bicipital aponeurosis. This is the structure, that is the bicipital aponeurosis. Okay, the bicipital aponeurosis is an insertion of the biceps brachii muscle. So this is an aponeurotic insertion of the biceps brachii muscle. Okay, so the biceps brachii is inserted to the radial tuberosity. On the posterior part of the radial tuberosity, insertion of the biceps brachii. Okay, on the posterior rough part of the radial tuberosity, it is separated from the smooth anterior part by means of a bursa. There is one insertion. Another insertion of the biceps brachii is bicipital aponeurosis. This is an aponeurotic insertion of the biceps brachii, and it blended with the deep fascia of the forearm. Okay, this blends with the deep fascia of the forearm. Okay, we got the bicipital aponeurosis. Bicipital aponeurosis very important to protect the structures in the cubital fossa. Okay, we got the roof. Now we'll go to the floor of the cubital fossa. Floor is formed by the two muscles. One is the brachialis muscle. Okay, another one is the supinator muscle. So these two muscles forms the floor of the cubital fossa. Brachialis will insert into the coronoid process of the ulna. Okay, it will insert into the ulnar tuberosity and coronoid process of the ulna. Supinator, that muscle takes origin from the lateral epicondyle of the humerus, radial collateral ligament from annular ligament, and that will insert to the radius, middle of the shaft of the radius. Okay, this has dual innervation, innervated by the musculocutaneous nerve, also by the radial nerve. Supinator is important muscle. It is innervated by the deep branch of the radial nerve. So you got two muscles. One is brachialis and there is the supinator. Okay, we got the floor of the brachial plexus. Now we go to the contents of we got the floor of the cubital fossa. We got the floor of the cubital fossa formed by the supinator, that is present below and laterally, and the brachialis, that is above and medially, forms the floor of the cubital fossa. Okay, we got the floor. Now we'll go to find out the contents. Okay, contents are we got first content is the radial nerve. Radial nerve is hidden mostly by the brachioradialis muscle. Then, okay, we'll go to find out the biceps brachii tendon. Okay. Okay. Third content is the median nerve. Okay. Okay. So we got, before getting the third content, we go to the actually radial nerve, biceps brachii. Then we get the artery, the brachial artery. Then we get the median nerve. So we have four contents. One is the radial nerve, that is coming from the posterior cord of the brachial plexus. Okay, biceps brachii muscle, tendon. Okay, the brachial artery. Okay, then the median nerve. Okay, the radial nerve has two divisions under the brachioradialis. One is superficial branch, that is cutaneous. Okay, we have deep branch. Okay, this branch passes through the supinator passes through the supinator and it becomes the posterior interosseous nerve and becomes the posterior interosseous nerve. That nerve supplies the muscles at the back of the forearm. Okay, we got that. Posterior interosseous nerve, deep branch of the radial nerve, superficial branch of the radial nerve. Okay, so deep branch goes through the two sets of muscle fibers of the supinator and it becomes the posterior interosseous nerve that nerves the muscles of the back of the forearm. Okay, we got that. Radial nerve. Okay, how about median nerve? This median nerve, this passes through the superficial and deep fibers of the superficial and deep fibers of the pronator teres muscle, of the pronator teres muscle. Okay, we got that. The median nerve supplies the flexor muscles like that of the flexor carpi radialis. Okay, it also supplies the palmaris longus, flexor digitorum superficialis muscle. Okay, we got the median nerve. So to remember that, median nerve passes through the pronator teres. Deep branch of the radial nerve passes through the supinator. Okay, median nerve comes out of the brachial plexus from the lateral cord and medial cord. Radial nerve comes out of the posterior cord of the brachial plexus. Okay, we got the contents. So we got that. So let us summarize again very quickly. Okay, so we have a triangular depression just situated on the front of the elbow. It is situated below the elbow band on the upper part of the ventral aspect of the forearm. Okay, we have two muscles. This is the lateral epicondyle, medial epicondyle, and this is the brachioradialis. Okay, and this is the pronator teres. Okay, this is the brachioradialis, this is the pronator teres, and is the imaginary line connecting the lateral epicondyle, medial epicondyle. Okay, we got the boundary. Floor is formed by what two muscles? One is supinator, another one is the brachialis. Roof is formed by what structure? Skin, superficial fascia, deep fascia, bicipital aponeurosis. What are the contents of superficial fascia of the roof of the cubital fossa? Answer should be median cubital vein. What is median cubital vein? It is a vein that connects the cephalic vein to the basilic vein in a diagonal fashion. Okay, we'll get cutaneous nerve of the forearm also in the superficial fascia of the roof. Cutaneous nerve of the forearm, that is the medial cutaneous nerve of the forearm, that is a branch of what? Brachial plexus. Which cord? The medial cord. What is the root value? CAT1. We'll also get the lateral cutaneous nerve of the forearm, that is a continuation of what? That is a continuation of the musculocutaneous nerve at the elbow band area. Okay, what is the root value of the lateral cutaneous nerve of the forearm, there should be C5, C6, C7. Okay. Then we have to know the bicipital aponeurosis is an insertion of the biceps brachii muscle. Bicipital aponeurosis is essential for the supinator function of the forearm. Okay. And bicipital aponeurosis protect the underlying structure. It blends with the deep fascia. Okay. So it is also a part of the roof of the cubital fossa. We got floor, we got the roof. Okay, floor is formed by the brachialis and supinator muscle. Content from lateral to medial, radial nerve, biceps tendon, brachial artery, and its bifurcation. Brachial artery, you have to now consider the content. One of the content is brachial artery. Okay. Brachial artery is a continuation of the axillary artery. Brachial artery bifurcates in the cubital fossa into one is the ulnar artery, another is the radial artery. Radial artery, and another one is the ulnar artery. Okay, ulnar artery. Ulnar artery is larger than that of the radial artery. Okay, from radial artery we'll get radial recurrent artery. From ulnar artery we'll get ulnar recurrent artery. Plus we'll get from ulnar artery common interosseous artery that should have again anterior interosseous and posterior interosseous. From posterior interosseous we'll get recurrent interosseous. So from ulnar artery we'll get ulnar recurrent artery, we'll get common interosseous artery, common interosseous artery. Okay. From common interosseous artery we get anterior and posterior interosseous artery. Okay. From posterior interosseous artery we get a recurrent interosseous artery. Okay. From radial artery we get what? Radial recurrent artery. Radial recurrent artery. Okay. Okay, we got that. We have to remember that blood vessel has a lot of variation. The brachial artery may have terminal branches, not in the cubital fossa, it may be in the arm, even in the axilla. Okay, just close to the axilla. Okay, so it is possible to have variation in the artery. So it is not necessarily in the cubital fossa, maybe in the arm, not in the axilla, in the arm. Okay, so we get, these are the branches of the artery in the cubital fossa. So brachial artery is a continuation of the axillary artery. Okay, so we got the content. Now we go to some of the clinical importances. Clinical importance of the cubital fossa. Okay. So clinical importance, it is, we'll get the median cubital vein. So specifically median cubital vein, it is the mostly chosen vein for venipuncture for any region, for intravenous injection to draw blood, to give blood transfusion. Okay, we have the brachial artery. Brachial artery, it has importance. It is a conventional site to place the stethoscope after putting a cuff around the arm, so to assess blood pressure. To assess blood pressure. Okay, so these are the clinical importances of the cubital fossa structures. So we got that, and must remember that we may have variation in the middle cubital vein. We may have variation like that of the brachial artery and this division. We may not get exactly this is the, here is the median cubital vein. This may not be like this. Okay, so it may not be present even sometimes. So, or we may have connection not in the cubital fossa at the upper level, maybe at the lower level. That is possible. So there may be always variation. Okay, you have to consider that part. But this is the chosen vein for venipuncture, for blood transfusion, intravenous injection. Okay, so that's all about cubital fossa. If you have any question, please feel free to ask me. Please share the information with your friends. Have a nice day. Bye now. Thank you.